and welcome to Academic English. Today we are going to focus on Speaking Role-Play 2. We are going to look at the organization, some sample answers, and also we will do a role-play. Well, I will do it and you can follow along. Okay, so let's begin. So CELBAN Speaking Role-Play 2 comes after Role-Play 1, and this role-play is asking you to give discharge instructions to the patient. Remember, for the speaking part, you need a CLB level 8 to pass, and there's no specific time, but aim for about 5 minutes on this role play. Remember, you only have the total time, which is 25 to 30 minutes for the entire speaking interview and all their components. So I would say about 5 minutes, it's good time to spend on this task. There are two examiners examining you in the speaking for CELBAN. One usually interacts with you and the other one writes down feedback, but they both mark your speaking together. Sometimes they even switch. So if one of them interacts with you in role-play 1, the other one will interact with you in role-play 2. And you do have a few seconds to look at the instructions. So if you have any questions, ask them before you begin the role-play. Okay. So for example, if you look in these two scenarios, you have medication, Levaquin, and you don't know what it is, or if if you don't know, you may know what it is. But if you don't know what Levaquin is, you could ask. You could say, "I'm sorry, I'm not familiar with Levaquin. Could you please explain what it is or tell me what it is?" Sometimes they give you the definition either next to it in brackets. So for example, with Benadryl, it tells you it's an antihistamine. With EpiPen, it tells you at the bottom what it is. So keep an eye on that. But if they don't have that and you don't understand either a medication or an entire instruction, then make sure to ask before you begin the role play. Now, because you are the nurse in this role play, you are responsible for beginning the role play. So whenever you're ready, ask or tell the examiner, "I'm ready to begin role play 2." And then you will begin with, "Hi, my name is," and so on. There are typically 4 to 5 discharge instructions per task. So as you can see in both of these scenarios, 4 to 5 instructions, fairly simple, easy to understand instructions. Now, in terms of the organization of the response, you do need to have an introduction. You need to give the instructions one by one, and you need to have an ending. And now we're going to focus more on this organization. We're going to break it down step by step and learn also some strategies for it. So in this video, we will focus on this role play scenario. It is very important to understand the instructions because you need to use some of that information in your role play. So in this case, it says you are a nurse in an emergency department and your patient came in with a severe allergic reaction. For task 2, give the instructions about managing an allergy. Include the points listed on the sheet in your explanation. Do not just read this list to the patient. Give the instructions and make sure that they have been understood. And then he says, take some time to look at the form and the points listed below it. If you have any questions about the form or instructions, please ask. When you're ready, you can begin the conversation with your patient. So first one says, carry an EpiPen at all times, take Benadryl antihistamine as needed, come into the ER if breathing becomes more difficult. You can go home now. It is important that you rest. So you can read this quickly before you begin your role play, but don't focus too much on reading them or how are you going to explain them. Remember, you only have 25 to 30 minutes for the entire speaking. You don't want to lose any time. But you can take some time to read them quickly, make sure you understand them. Okay, so first of all, in role play 2, you need to have an introduction. Very first thing you will do is to introduce yourself to the patient. So you will say, "Hi, my name is I'm one of the nurses. Now, do you remember where you were? The scenario was in the emergency department, right? Keep that in mind. I'm one of the nurses in this emergency department, and I'll be taking care of you today. Okay, so this is one way you could introduce yourself. The next step is to verify the patient's name. So you can say, to ensure that I am talking to the correct patient, could you please state your name? And then make sure to ask the patient, how would you like me to address you? Okay. And then the last component in the introduction is to explain why you are there. Remember from the instructions to give discharge instructions about managing an allergy. Okay. So you could say to the patient, I'm here to give you some discharge instructions or some information about managing your allergy at home as you recover after your discharge. They don't test your medical knowledge. So as long as you follow the organization and you explain in your own words, then you are good to go. Hello, my name is Sue. I'm one of the nurses in this medical ward, and I'll be looking after you for the rest of the day. I would like to double check that I'm talking to the correct patient. So could you please state your name?
Albert Smith.
And how would you like me to address you?
Albert.
Okay, Albert. So it looks like the doctor is going to discharge you today. But before you go home, I would like to give you some instructions on how to manage your allergies at home, and also to help you recover from this recent allergic reaction. Is this a good time?
Yes.
The introduction should be very flowy and easy for you to do. The more you practice, the easier it will get. Just remember to have all three components in your introduction. Now, in terms of the instructions, remember the first instruction said, carry an EpiPen with you at all times, right? That's our instruction. It says in the instructions as well, do not just read the information to the patient, give the instructions and make sure that they have been understood. So your first component of giving the instruction is your transition word. So you could say first, next, after that, following that, another, and so on. Just use a transition word when you begin. You're going to give the instruction in your own words. So that means you cannot just use the same format for grammar like here, or just say carry an EpiPen with you at all times. You cannot do that if you don't want to lose points. So change the grammar, change the wording. This will boost your vocabulary score. So you could say the first instruction that the doctor has for you is in regards to your EpiPen. It is important to have an EpiPen with you all the time. Okay, so try to change as much as you can the structure of the sentence so that you're not repeating the same sentence. The next component is to explain. So you gave the instruction, you use all the keywords, you're trying to change some of the keywords to boost your vocabulary. Now the next component is to explain the instruction. EpiPen is a shot of epinephrine, which when injected will help relieve the symptoms of an allergic reaction. Again, you're not judged on your medical knowledge, so it doesn't matter how you explain this to the patient as long as you explained it. And as long as it makes logical sense. Okay, and then the last part is to double check the patient's understanding. So you could say, could you do this? If you're asking them to do something, will you do this? Do you have any questions? Is this clear? All of these expressions are good for you to verify the understanding. And when they are done, they move on, or you move on to the next instruction. First instruction that the doctor has written down is to carry an EpiPen with you at all times. This is important because allergic reactions are sudden and unexpected. And if you have a more serious allergic reaction, you could simply use the EpiPen to help you before you go into an anaphylactic shock. Is that clear? Remember the 4 components: transition, explanation, or sorry, instruction. Let's not forget that. Explanation and verification. One of these. I'm giving you a lot so that you could choose so you don't repeat the same ones all the time. This way you don't lose points for vocabulary. So try not to say to the patient for each instruction, is this clear? Is this clear? Is this clear? Right? Okay. And then for the ending, once you're done with all the instructions one by one, you are going to move on to the ending. The very first part in the ending is to let the patient know that you are done. Obviously, you're not going to say to them, I'm done, right? So you could say, this is all the information that I needed to give you. These are all the instructions that I needed to give you. And then you're going to allow the patient to ask any questions. Do you have any questions before I leave? And then you're going to wish the patient well. This is very important. So get well soon. I wish you a speedy recovery. And so on. These are just a couple that you can use. Okay, these are all the instructions that I needed to give you. Do you have any questions before I leave?
No.
Good. Well, get well soon. Bye-bye. And that's it. That's the organization of your response. And now we're going to look at some tips and strategies for this role play, since you are marked on strategies as well. Number 1, try not to take too long before you begin the role play. So I would say about 30 seconds. Read the instructions. Remember, they're very short, so you don't need a lot of time to read them. And as you do your role play, then you can think about each instruction, how to explain it, and so on. As you do the role play, you don't have to have everything ready in your mind before you begin. So I would say about 30 seconds. Second tip is to let the examiner know you're ready to start. Don't wait for them to tell you. You can begin because they won't. Sometimes if you take too long, they will tell you, but you tell them, I'm ready to begin my role play too. Use good organization. You are marked on this. Make sure your role play flows. Keep it as a conversation. Don't rush through it, but use the organization. Do not read the instructions. Remember, you lose points for reading the instructions. Change the wording and the sentence structures, and basically say it in your own words. Use synonyms as often as you can so that you can get some extra points for vocabulary. This is a very easy way to boost your vocabulary score. Avoid repeating any of the information and be very concise. I've seen some students or candidates try to explain and then explain again and give the instruction again, and they just spend too much time, and at the end of it, it's very difficult to understand what was the instruction. They try to avoid any repetition. Give the instruction, explain it, verify, move on. Change the grammatical structure from the imperative to advice or recommendation. I'll show you what that means. So if you look at the instructions, it says take, carry, come, go. These are all imperatives. You cannot use words such as have to and so on. So change it from imperative into a softer tone, right? It is important to carry an EpiPen with you at all times, right? Obviously change the wording as well. But you see what I mean? Instead of giving orders, you're softening up a little bit. And this ties into the next part. Avoid words such as you have to, you ought to, must, or many of my students use you better. But instead use expressions like it is important to come into the ER. It is important, or it is essential to carry an EpiPen. It is crucial, it is necessary to, it is advised, it is recommended. So use these expressions instead. Make sure that your patient understood each instruction. Remember, in the instructions that they give you, they say, do not just read this list to the patient. Give the instructions and make sure that they have been understood. So verify patient's understanding. Is this clear? Can you do this? Will you do this? Answer the patient's questions well. The patient will have questions for some of your instructions, and these are never yes or no question. You should try to explain it a little bit, right? Try to answer it in a complex sentence and try to explain or answer their question with an explanation. It is important also to create rapport with the patient. Be friendly, smile. You are marked on this. This is one of the strategies. Number 14, if the patient disagrees with the instruction, show empathy and then persuade. You are marked on this as well. So if they say, well, no, I cannot go home now. I need to pick up my children from school and then I'll go home to rest. And say, I understand that this allergic reaction has been sudden, however, and then try to persuade them. Don't let the second examiner who writes feedback intimidate you. Sometimes you will feel intimidated by that because you feel judged. We don't like to be judged. Nobody likes to be judged. But remember, a lot of the feedback that they write down, it's actually positive feedback. CELBAN examiners write a lot of positive feedback in your feedback paper, and they submit this to you, or a lot of it to you as well in your scores, with your scores. Fluency, very important to speak at a normal pace, not too fast. So don't try to say 100 words per minute, but also not too slow. So try not to take too many pauses or think too much or it can you could lose point. You will lose points for that. If you're anxious about speaking interviews, and I think pretty much everybody is, especially in an exam setting, try to do some breathing exercises before the speaking exam. And even before you begin the role play, just take a big, deep breath and then you begin. And it's going to help expand your lungs. It's going to make sure you don't speak too fast because when you're tense, right, you speak too fast. Also, try to position yourself in a way that your lungs are expanding, that you're not hunched over, and, right? And this will also help with fluency. Remember, for the last strategy is that practice makes perfect. There are many ways to practice discharge instructions. Unfortunately speaking, you cannot practice by yourself. You could practice with the charts that you already know from CELBAN, the ones that we talked about today as well. Get a partner to practice with. If you could get somebody to give you feedback, that's very important. And this website has a lot of discharge instructions that you can practice with. They have thousands of discharge instructions that you can practice with, so you never run out of material. And good luck. Looking forward to all your feedback in the comments. Hello, my name is Sue. I'm one of the nurses in this medical ward, and I'll be looking after you for the rest of the day. I would like to double check that I'm talking to the correct patient, so could you please state your name?
Albert Smith.
And how would you like me to address you?
Albert.
Okay, Albert. So it looks like the doctor is going to discharge you today. But before you go home, I would like to give you some instructions on how to manage your allergies at home, and also to help you recover from this recent allergic reaction. Is this a good time?
Yes.
The first instruction that the doctor has written down is to carry an EpiPen with you at all times. This is important because allergic reactions are sudden and unexpected, and if you have a more serious allergic reaction, you could simply use the EpiPen to help you before you go into an anaphylactic shock. Is that clear?
Where can I get a new one? Mine is quite old.
Oh, that's a very good question. You could get an EpiPen from the pharmacy. I can just get the doctor to make a prescription for you, and then with that prescription you could get a new one. The second instruction that the doctor has for you is a medication. The doctor prescribed Benadryl for you, which is an antihistamine. It's important to take this medication as needed, meaning if you are stung by a bee or if you have an allergic reaction, that would be the first step, to take Benadryl to help relieve the symptoms. Is that clear?
Okay.
The next instruction is in regards to your breathing. If you're experiencing breathing difficulty while having an allergic reaction, or you think you're having an allergic reaction, it's important to come to the ER, and also as you're recovering from this allergic reaction. This is important because breathing difficulty is an indicator that your allergic reaction is quite severe and needs to be treated further. Can you do this?
How bad does it have to be before I should come in?
That's a good question. I'm glad you asked that. If you notice that you are taking a lot of short breaths in order to breathe, you feel like it's quite strenuous to breathe, then it's a good indicator to come in. Do you have any other questions?
No.
You are basically discharged, so you can go home now, but it is important for you to rest after you go home. This is because you're still experiencing the signs of your previous or your current allergic reaction, and rest will help you recover. How can you do that?
Well, I have to pick up my kids at school in about 45 minutes. I'll just pick them up and then go home. That's not a problem, is it?
I see. I understand that this allergic reaction was quite unexpected. However, I would strongly recommend for someone else to pick up your children from school, as you may not be able to drive right now. You're still recovering from this allergic reaction. You're under the effects of medication and you need to rest. So do you have somebody else that could pick up your children from school?
Okay. Yes.
Excellent. Okay, these are all the instructions that I needed to give you. Do you have any questions before I leave?
No.
Good. Well, get well soon. Bye bye.
Thank you.